Welcome back. Now, January is Cervical Cancer Awareness Month, a time dedicated to raising awareness about one of the most preventable yet life-threatening cancers affecting women. Cervical cancer continues to claim lives largely due to late detection and limited access to screening. Early testing, vaccination and awareness remain our strongest tools in the fight against this disease. To help us better understand cervical cancer prevention and the importance of regular screening, I'm joined by Dr. Cornelia Ndifon. Doctor, good evening and welcome.
Good evening, Nina.
Thank you so much for being here. Thank you. The same to you.
Happy New Year to Namibia.
Thank you so much, Doctor. Well, I know that this is a topic very close to your heart and that you're very passionate about. But to start us off with, Doctor, just briefly explain once again what cervical cancer is and how significant its impact is on women today.
Yeah, thank you. That's a very good opening question. So cervical cancer simply means cancer of the cervix. And cancer is abnormal cells, cells that have gone beyond boundary, not obeying any rules. Impact-wise, globally, it is the fourth commonest cancer in women, while in Namibia, it is the second commonest cancer after breast cancer. Impact-wise, if somebody has a confirmed diagnosis of cervical cancer, particularly the advanced form, it means that they are going to undergo what we call radiochemotherapy. And these treatments are not easy. Yeah, they affect, side effects are serious, things like hair loss, and sometimes even they, permit me to say, the private part, can be affected. And the cost is very heavy. Even if you have medical aid, you could deplete your medical aid like this. And then most of them anyway don't have medical aid, which means that they depend on government. And when you're undergoing treatment with all those toxicities, it means that you're going to lose your job. And therefore, there's no source of income for the family that is at home because they depend on you. And so, like I said, even relationships can end because people having we've seen cervical cancer in a 25-year-old woman, and we've seen in a 45, all these ages are like young and in their prime. Yeah, so the impact is huge in terms of getting a confirmed diagnosis of cervical cancer and worse still, an advanced stage.
This cancer is often referred to as one of the most preventable cancers. Why is that?
Okay, it's preventable for what I call maybe 3 or 4 reasons, highly preventable. We know the specific cause. We know the pathway, how we get to cancer. Then we also know that it is preventable by a vaccine. So there's a specific vaccine targeting that cause. And then it takes a very long time from the pre-cancer stage to that actual cancer, between 10 to 15 years in people that we can say are immunocompetent. But we know that immunodeficiency is a big problem. And so in people that are immunodeficient, you can say 5 to 10 years. Now, 5 years is long if people can just go for screening. And that's why we are saying that we have enough time if people will just, sometimes I say, take it as your right. Walk into any place and ask to be screened.
Let's talk early signs, Doctor, warning signs that women should be looking out for that, would develop and give a hint that something's amiss.
Yes. So like I said, we don't want the cancer. So signs of actual cancer will be what we call abnormal vaginal bleeding. I always say menstruation is normal, God-given, natural sign of womanhood, and it once a month. Anything outside that is not normal. So when you have what we call irregular vaginal bleeding, abnormal vaginal bleeding, meaning in a cycle where menses is once in a cycle, now you are bleeding maybe just anyhow, if I can use that word. You know that this is not your menses. Don't just take it lightly. Go and present yourself to the doctor or nurse and say, I'm bleeding like this. Okay, postcoital bleeding. Normal sex, all things being equal, they should not be bleeding.
Yeah.
So if you bleed during sex, also report it. Then there's what we call unusual vaginal discharge. What is unusual? The color is not okay. The smell is not okay. The quantity is not okay. There is what we call secretion, again, which is healthy to keep the place moist. But once secretions become excess, it becomes offensive. You can tell that you are not comfortable around people. Or maybe a partner says, what's going on here? You report those things. Lower abdominal pain or lower abdominal discomfort, yeah, you should go. Then lower back pain, okay? Frequent, I'm not fine down there. People should not just prescribe blindly. Maybe do it once, maybe twice. But if a woman keeps coming, you need to look at that cervix. And in some cases, the whole point about screening is that we don't want symptoms. Why must you go for screening even when you are looking so healthy? Is that you are sexually active. And the cause of cervical cancer is a sexually transmitted infection. And please, people, adults that have sex, should I say, you don't owe no one explanation. Just go and say, screen me. Yeah.
We know now, of course, that we have a HPV vaccine, which is the STD that you alluded to earlier that leads to one developing cervical cancer. To talk to us about this HPV vaccine and the role it plays in prevention, doctor.
It plays a very significant role. So like I said, why is it highly preventable? We know the cause, and the vaccine has been developed to target the cause. So HPV vaccine, it is best given to young girls before sexual debut, or what we call sexual exposure. So what does the vaccine do? It is mimicking infection and helps the body to sort of prepare itself so that when you actually get exposed to the actual virus, it has no place to attach. It's like all the avenues there has been blocked. Because how does the cancer even start? Any sexually active person might or would have been exposed to HPV at some point in their life. When the immune system is very good, we say that 90% of this HPV is cleared. Remember, these things are microorganisms. You don't even know that you have been exposed. Yeah, they are cleared. But where there is immunodeficiency, it persists. That persistence is what is damaging the tissue. And over time, the cells, you know, the DNA of the cervical cells is taken over. And then this HPV is running haywire and then causing havoc. So it is that persistence. Now, when they give the vaccine, like I said, to young girls before sexual exposure, the vaccine mimics actual infection and stimulates the immune system to prepare, to counter.
In a manner building antibodies.
Antibodies are formed. Sometimes when I'm talking to the public, I don't want to mention very big grammar. So, yes. And so the vaccine, therefore, it really, really is important. And the countries who accepted vaccination right from the onset, because the vaccines have been there for more than 15 years.
Have they showed lower rates of women with cervical cancer?
Yes, 90% efficacious. 90%. I'm telling you the truth.
You've stressed early detection, doctor, and you've also mentioned that you shouldn't wait until you've got symptoms. Even when you think and feel okay, go and get screened. So how often should a woman do that, go for screening?
Yeah, that's a very good point also. So we divide, or the WHO has given us guidance. So broadly, we group women into two, HIV negative and HIV positive. HIV positive have immunodeficiency. So these people, WHO says they should start to screen from the age of 25. And screen beginning with HPV DNA testing. We need to see that HPV, or we need to look for it in combination with pap smear.
Right.
So the HPV damages the cells. The pap smear confirms the damage. Are you getting me? Yeah. And the HIV positive should screen every 3 to 5 years.
Okay.
Okay. HPV DNA. Do we have HPV there? Has it caused damage? Pap smear cytology. Because of the immunodeficiency, they need to do it every 3 to 5 years. HIV negative are immunocompetent. Okay. WHO recommends they start to screen at the age of 30. They must also do HPV DNA plus pap smear. Okay. Now, if these 2 sets are negative, they do every 5 to 10 years, the HIV negative, every 5 to 10 years. But these times we are giving are based on both results being negative.
Right.
Are you getting me? Irregardless of their status now, if you get positive of any of these, HPV DNA, abnormal cytology, in HIV negative, HIV positive, then the healthcare worker, the doctor, the specialist, they will now manage the problem. So that one has nothing to do with 3 to 5 years, because if I see a problem and it's going to kill you next year, maybe I'm going to say your results are not okay, come back next week or come back in 2 weeks. We need to now manage that problem. And in that situation then, you might pick early cancer. There's what we call microscopic cancer. Then there is what we call gross cancer, where your naked eye say that this thing doesn't look nice. And then you might want to plan surgery, this chemotherapy, radiotherapy, and things like that. And sometimes with surgery, if a woman has completed her family, for example, you just say, look, let's remove this thing, and you are as good as cured. So that is the beauty of early detection.
Dr. Ndifon, it's always a pleasure having you with us.
Thank you
so much for being here tonight. Thank you. That was Dr. Cornelia Ndifon speaking to us there on Cervical Cancer Awareness Month, which is commemorated every year in January. We'll be right back.